Okay, first of all, I would like to say Kuzo Zangbola to all the respected gurus, the chair, and all the audiences present here today. My name is Phurba Sherpa, and I'm here to represent the Executive Youth Committee of the Buddhist Community Centre UK. It's also known as BCC UK. Tomorrow, the founder of BCC UK and also my wonderful dad and a role model, Mr. Kaju Sherpa, will give you a brief introduction about our centre. However, today, I'm here to talk about a different topic. Before that, I would just like to let you know that I'm originally from Nepal and currently residing in UK. And it's a great pleasure and my honor to be part of this conference. So my topic is about the mindfulness meditation in reducing stress. The reason I chose this topic is because I will be mainly focusing in the healthcare settings, and the reason behind that is because I myself has worked as a registered nurse in the NHS, the National Health Service in UK for a few years, and currently now I am a medical student in the University of Keele. So, throughout my experience of working as a healthcare professional and being a medical student, I realized that stress is the biggest challenge facing healthcare professionals today. And I believe that it's extremely important that we have the effective strategies in reducing stress so that it can not only benefit the healthcare professionals, but also provide the best care to our patients. So I would like to begin. So initially, I started with a question: is mindfulness meditation effective tool for reducing stress? So that was the question I began with. So my presentation today will cover about the stress and its impact on our health, the introduction to the mindfulness meditation, some research is supporting the mindfulness-based stress reduction program, and finally the effectiveness of the MBSR program in the healthcare. According to the Great Britain Labour Force Survey, 2014 and 15, stress accounts for 35% of all the health-related cases, and 43% of all the working days in the healthcare settings are lost due to just because of stress. So, how to define stress? Stress is defined as the body's response to both physiological and psychological demand. As we all are aware, acute stress is extremely important for us in terms of survival, the fight or flight response. However, the long-term stress has a very significant impact on our both psychological and the social well-being. And to give an example, the psychological impacts such as the mental disorders, depression, anxiety, panic attacks, and so on. And the physiological impact such as the increased risks of cardiovascular disease, stroke, even cancers, and compromised immune system. So to talk about stress, cortisol is found to be the primary hormone that is released by the hypothalamic pituitary adrenocortical pathway, which is found in the brain. So as we all are aware, there are many various strategies for reducing stress, and mindfulness meditation is known to be one of them. So to define the mindfulness meditation, it's actually derived from the Buddhist philosophy and practice many years ago. And the mindfulness meditation has been around for a long time. So mindfulness meditation is the practice of focusing the attention onto the thoughts and the emotions arising in the present moment, completely accepting it without judgment. So understanding the importance and the effectiveness of mindfulness meditation, Dr. John Kabat-Zinn, the gentleman on the picture there, he invented and introduced the mindfulness-based stress reduction program in the stress reduction clinic in University of Massachusetts in USA in 1979. So this mindfulness-based stress reduction program is an 8 weeks long program with with main intention is emphasizing the importance of mindfulness practice in our daily life. There has been many researches done since the beginning of this program, and the benefit seems to be it allows an individual to handle the stress and the negative emotions in a very effective way. And also the salivary cortisol level, which is used as a measurement for stress, is found to be lower after the practice of the mindfulness meditation. And MBSR has also an effect on the brain. It allows the better control of our emotion through the prefrontal cortex. It also, it's a part of the brain which is involved in the very high cognitive functioning and also the interpretation of the social values. It also showed that there was a vast reduction in the amygdala activity, and amygdala is also a part of our brain that is responsible for regulation and management of our emotions, anger, and frustrations. And somebody mentioned about the electroencephalogram earlier as well. And so when the electroencephalogram was done on the Buddhist monks who have done meditation for many, many years, it found that there was a high amplitude of gamma waves noted. And gamma wave is associated with a very deep sense of compassion and happiness. And as Dr. Wang mentioned earlier, the effect of meditation is related to improving of the oxygenation of our neurons, which are our brain cells, and also it enhances providing appropriate nutrients to our cells in our body. Being a medical student myself, I was very keen to see the effect of MBSR in the medical student. So the research showed that it showed a vast reduction in the psychological disorders such as stress and anxiety. And also it was found that the students who listened to the mindfulness-based guided meditation seemed to have a benefit as well. And I believe that the mindfulness meditation has a huge positive impact in our healthcare. And the main thing is it enhances a good and effective relationship within the healthcare professionals and also with the patients. And I think the main focus of that would be enhancing the importance of compassionate care, which is also the core of our Buddhist teachings. It also showed that it enhances the clinical decision-making process, which is very extremely important in the healthcare professionals because we are dealing with lives of other human beings. It also showed that there was a vast reduction in the medical errors, which again will have a huge positive impact on the care that we provide to our patients. And I think I've nearly come to the end of my presentation. So finally, I would like to conclude by saying that after reviewing some of the researches on mindfulness meditation and also practicing the mindfulness meditation myself, I strongly believe that mindfulness meditation is an effective tool for reducing stress, and it also has a very positive impact on the healthcare by providing the very safe and effective care to our patients, enhancing the importance of compassionate care. And finally, I've finished with my presentation, but I would just like to say a big thank you for the kind hospitality that has been provided to us since we entered this country. And I would like to say that I'm not surprised at all why Bhutan is known as the happiest country in the world. And I would like to personally describe Bhutan as heaven on earth. And once again, thank you very much for your patience, and thank you very much for listening. I have to say it right. Kadrin Che and Tashidale. Thank you.